Here comes Brown. Smart on one side by Wiggins to the right.
Oh! Ow. Ooh.
He's concussed.
Torn ACLs, nasty fractures, and LeBron James playing through a foot injury like it's nothing.
It's LeJon Brames.
Today, we're breaking down some of the most unforgettable basketball injuries in the NBA. Let's dive right in.
First game back is usually trouble. Amadou inside.
Oh.
Fouled on the shot try. Down he goes, and down goes Jetty Osman.
Why is it so yellow? Yellow liquid out of our bodies from probably his sinuses, most likely having a sinus infection. Not all sinus infections require antibiotics. About 80% of all sinus infections are actually viral that will just go away pretty much on their own.
Points and fast break points that has created this margin for the Knicks.
Whoa, nice move. Uh-oh.
Off the backboard, but he's holding on to that
Down.
left knee. Since he's returned, that's the first dunk that he's had.
Lands on his left knee, kind of buckles as he lands, hopefully just causing a strain or like a muscle spasm versus injury to the ligaments. We have 4 ligaments of the knee that we worry about: the ACL, the PCL, the MCL, and the LCL. And then you have the medial lateral meniscus, as well as the bones.
And you look at his eyes, and there's concern now for Embiid of the Sixers. How about a man
interesting. His left eye is not blinking. Sometimes that can be in reference to, say, a stroke or a Bell's palsy. Bell's palsy, cranial nerve 7 is not working appropriately, typically due to a virus such as like herpes, or it could also be related to Lyme disease as well.
Goes up, throws it down, and lands hard on that knee right away.
Most of the time, how we differentiate a stroke versus Bell's palsy is when you try to lift your eyebrows up. In a stroke, you will actually be able to do that, but not have the function of the lower part of your face. Versus when you have Bell's palsy, the whole side of your face looks like you've gotten Botox injections where nothing works.
So Joel Embiid, they'll take their time checking him out.
If we are concerned about a stroke, we'll end up doing a stroke workup, including a CT scan of the head, and depending on the timing, could actually get a CTA, head and neck, as well as an MRI and other blood work. If you begin having any neurologic abnormalities to your face or your body, please get to the hospital ASAP. Don't wait.
Since then, though, 0 for 6.
Oh,
As he has it,
we got Kobe. Oh,
he's hurt.
oh,
He's hurt.
oh. Ow, still walking on
I
it.
don't know if he's going to be able to continue.
Left ankle, could be ligamentous injury, could be a fracture, could be sprained, but in this circumstance relating to Kobe Bryant, he injured his Achilles tendon. Tendon at the back of your ankle, having to do with all your calf muscles.
This might be that same knee that he hurt.
No, this
Is
seems
it
like
something
it's
different?
no, this is the right foot or the
All
right
right.
leg. I mean,
If you rupture the Achilles tendon, there's no connection of being able to contract those muscles and push off. A lot of times you'll actually see somebody's foot not working the way that it should, can't really lift it up or flex it down. LeBron, nice. Uh-oh. Oh, grabbing that right foot. The ankle was rotated externally, and then there's the potential that he sprained his ankle because of the force. Most ankle sprains actually go inward versus this one went outward. You have a big ligament on the medial aspect of the foot, which can get strained, ruptured.
So he makes the move. There's the
Oh, ouch, ouch, ouch.
Just sort of lean in a little bit.
He was definitely favoring that ankle even before falling onto the ground. Probably will get an x-ray of that just to make sure that the bones are intact. We'll probably end up getting an MRI thereafter to see what type of tendon or ligaments might have gotten injured.
But watch him when he lands. He did not want to come down on that right foot.
Coming back from some of these brutal basketball injuries, recovery isn't all about physical therapy. It also starts with deep sleep. If you need better rest, check out Do Not Disturb by my company Life Happens. Find it at lifehappens.com or on Amazon. Wow.
There was an inadvertent whistle on the play. There was no foul.
If somebody has a sprained ankle, we can put them in an ACE wrap, we can put them in an air splint, or we can put them in a boot or a walking boot. Sometimes we call it a cam walker boot. It's basically like a splint, but you can take it on and off pretty easily and you can walk on it. It was noted that he ended up having a boot placed on that. Oh, Steph Curry.
So he shot the three and then tripped and
Oh, I think Steph Curry ended up having a fracture to his tailbone. Hairline fracture versus broken bone, they're all the same. When you have a non-displaced fracture of a bone, this will heal pretty well.
To stop his reach it back. Maybe thought there was going to be a chair there or something. He's fading
That's
away
that is the worst. The tailbone is not something that you can splint or put a cast on. It just sucks. Bruised tailbone as well as a fractured tailbone are pretty much treated the same way. Pain medication as needed, decreasing the activity that's causing the pain, and sitting on a donut. Oh. Uh-oh. Oh, look at that elbow. Woo, ouch. Most likely a posterior dislocation of your elbow. That point right there is actually your ulna. You have your humerus here. It cups like this. So what ends up happening is when it goes posterior, this shifts out. So when he puts his arm backwards to brace his fall, majority of the time what we'll end up doing is get an x-ray, see if there's a fracture first, make sure there's no bony fragments within the joint itself, but we still need to put it back in. Different people have different pain tolerances, so you're gonna get pain medication, but putting it in, sometimes you need to sedate an individual using conscious sedation. Oh, LeBron.
LeBron got cracked in the head. Maybe he was going to try to pull him down.
Oh, ow. Oh, a poke right into that eye. Oh, that is the worst. If you even just push on your eye itself, it is painful. The cornea is super innervated, highly sensitive. You worry about laceration to the globe itself. Treatment of an abrasion or a small corneal injury laceration that doesn't go into the globe would be topical antibiotic ointment and keep the eye closed, which might feel better, at least for a couple days, as well as pain medication.
Here comes Brown. Smart on one side by Wiggins to the right.
Oh, ow. Ooh.
He's concussed.
I like how they use the word concussed. I mean, that's a derivative of a concussion. Concussions we worry about a lot because of your brain. Could be with loss of consciousness or without, and it could have neurologic effects. Seeing stars, nausea, vomiting, headache, off balance, feeling dizzy. He got his bell rung.
And they have that.
If somebody is diagnosed with concussion, they're out for at least 24 hours. And then you would get reevaluation. To get back into playing again, somebody needs to be without symptoms for probably 24 hours and cleared by their doctor in different protocols. Sports-related injuries, basketball, they have a lot. It's heavy contact. These guys are very good athletes, but again, they're still at risk. So just be careful out there as well. If you guys enjoyed me reacting to these clips, let me know in the comments. We can do more sports-related injuries, and make sure that you binge watch this playlist right here. Watch everything for me. Subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.